the difference between setting like functional versus distress tolerance goals resonated because I think for a lot of my treatment, I've been focusing on functional related goals as I like progress through grad school and things like that. And that was kind of like what I needed to do at the time. But I think I'm recognizing that the true like work is like in the distress related goals. Like it's really easy to like we were just talking about, I shouldn't say it's really easy. It's over time become easier to decrease like the amount of times you give into a compulsion. But I think what's harder is when you are okay with how uncomfortable you feel and how urgent you feel and how like palpable the consequences of not doing something feel and still decide to like not give in to that because they're a little different, I think.
Yeah, you're saying a lot. You said a lot just now. So let's elaborate on each point. So, first, when you're saying I kind of got used to setting functional goals, can you just be more specific about that?
So like I will drive every day. Like I won't avoid driving because I need to get where I'm going, even though I have OCD content around that.
Yeah, really well said. So basically, functional goals are these are my priorities, obligations, and values in my life. And I'm going to set goals to ensure that I do all the things associated with the life that I want to live, regardless of how I'm feeling. But basically, however I get there, I'm still going to drive. Are there other functional goals that you've set over time that are worth talking about?
I mean, I'm sure I probably set like 100 just because of the widespread nature of my content.
So not just for you, just for the listeners, other functional goals that are really common are things like I'm always going to eat 3 meals. I'm always going to shower. Sometimes I'm going to shower and set a timer for how long I'm going to be in the shower. Actually, your daily routine across the board could have functional goals associated with it. So I'm always going to brush my teeth, but I'm not going to brush my teeth for longer than 5 minutes could be a distress tolerance goal, which we'll talk about in a minute, but is also a functional goal because you likely need to get to work or school. So it's important that you brush your teeth, but not for longer than is necessary. So your daily routine, eating, sleeping can also be a functional goal that people set parameters around. Ensuring that you get out of the house if that's challenging for your OCD, ensuring that you drive, especially when that's challenging for your OCD or your other anxiety disorder. Sometimes, if you have social anxiety, you may need to set goals around I'm going to make sure that I go to work a certain amount of days or I attend social events a certain amount of times, that I go on dating apps or I commit to dates. All of those will likely be triggering situations and bring up thoughts and sensations and our opportunities to practice. But you can also see them as functional goals